throughout our lives and often forced into shoes that squeeze them in ways they just weren't designed to be squeezed. We are looking at ways to avoid foot pain and problems with. This morning, we have Manhattan podiatrist Dr. Oliver Zong. We thank you so very much for coming in and for joining us and for helping us to wear all those stylish shoes that we probably shouldn't put our feet into. What are some of the biggest problems you see?
First of all, good morning. It's good to be here. I watch you guys all the time.
Oh, well, thank you.
Some of the more common problems are ingrown toenails, and it seems to be the flavor of the week. I just saw 3 yesterday in my office. I think a lot of it has to do with people coming back to work now wearing their tight shoes. Over the summer, they may have been wearing open-toe shoes or walking on the beach barefoot. And now that they're doing a lot of walking in tight shoes, they're getting the ingrown toenails, and oftentimes it happens to the big toe, and you're the first to know. It turns red. It's quite painful. And if you let it go, which a lot of people, they want to try and see whether or not, well, it'll get better. If it does, oftentimes it can lead to an infection, and you have an infected ingrown toenail with, you know, some not good stuff oozing out of your toe. And at that point, that's usually when they come to see me.
Okay.
The treatment for it is very simple. It's usually a very quick in-office procedure. It's a little bit painful. I mean, you get a little anesthesia in the toe, but then that's it. The ingrown portion comes out, and you should be fine.
Okay, very good. So let's move on to those ugly bunions.
Absolutely. Bunions are part hereditary, okay, and they're partly caused by shoe gear also. So if you have a foot...
Now here's a shoe. Now, the shoe doesn't bother me. The heel is a little high. I don't do a lot of walking in it. But would something like this cause bunions?
It could. If you have a foot type that doesn't fit the shoe, if your foot's too wide, it can help exacerbate a bunion, okay? Like I said, part of it is hereditary. So if family members have it,
ugly, Doc.
you're more prone to get it.
That is the bunion.
Absolutely. Right, it's that bump by the big toe. And often associated with the bunion, you can see the second toe, you often get hammer toes.
You get hammer toes, yes. Well. But they can be corrected, is that right?
Absolutely. If they become painful, then absolutely, you shouldn't walk around in pain. You absolutely can have it corrected.
Okay, let's move on then to corns. Heard about those from a kid. It's always somebody had corns.
Absolutely. We commonly refer to them in our office as foot uglies.
Foot uglies, okay.
Generally, they are thickened pieces of skin, and they commonly occur in this area on the knuckles of the toes and on the bottom of the feet, most commonly on the pinky toes.
Okay, so now you said on the knuckles of the toes.
Exactly, on the knuckles of the toes.
But also the bottoms of the feet. Okay.
And on the pinky toes most commonly. That's usually what hurts most women.
Okay.
Again, if your foot's not made to fit into that shoe, it's easiest to just get a shoe that fits. Of course, this being New York, you could always make the foot fit the shoe.
Okay, yeah, then we're looking at some pictures there. But now those can be removed. I see a lot of products in the store even. Are those good?
Yes and no. I mean, if you have just a very mild corn or a callus, you can use those products, even a pumice stone. If you have anything more than that, you really should see your foot doctor. At that point, they can determine whether or not you can handle it yourself at home, but at the same time, they can also debride it in the office. Okay.
And you know those razor blades? You know who you are out there. I've seen you with those razor blades trying to remove those corns. Not a good thing.
Yeah, absolutely. Kitchen and bathroom surgery isn't recommended.
It isn't recommended. All right, what's the best type of shoe that a woman should wear, a man should wear?
In general, it's a shoe that's comfortable, okay? Heels are not necessarily bad. I tell a lot of my female patients actually to wear heels because they've been wearing heels for a good part of their lives. And for them, walking in a flat shoe is actually painful. And they can get things like plantar fasciitis, heel spurs, and things like that, or arch pain. And in those patients, it's actually better for them to walk in a heel to relieve the pressure.
All right. Dr. Oliver Zong, we want to thank you very much for joining us this morning. Thanks for watching our show. It's always good to have a new